So our second lecture on the cranium is about special features that are seen in the cranium. The first of these special features are the 7 bones that make up the orbit, and I do want you to know each of the 7 and what part of the orbit they form. The first one we see is the frontal bone, and it's going to make the roof of the orbit. The next one we see is the maxilla or maxillary bone, and it forms the floor of the orbit. The next bone is the zygomatic bone, which forms the lateral wall of the orbit. The next bone is the sphenoid bone, and it forms the posterior wall of the orbit. And then we see our palatine bone, which is a very small bone. Again, it comes from the roof of the mouth, floor of the nose, up the sides of the nose, and it's going to form this little part in the posteromedial wall of the orbit. We see our ethmoid here in the medial wall of the orbit, and we can see its air cells there, its little sinuses. And our final bone is the lacrimal bone, which is here in the front, and it has the fossa and the foramen for the nasolacrimal duct. So we'll see the lacrimal foramen sending it down to the internal nose. Now, the junction of these 7 bones is important because it forms the orbit or the protection of the eye, and also allows the different nerves and arteries and veins to get to the eye through the openings. A last clinical note, a blow coming into the face kind of medially can hit against the ethmoid bone, and that can cause the very thin bone covering those air cells to break. And when that happens, we get what we call a blowout fracture. And a blowout fracture means that there's tiny little fragments of bone, and it's going to cause a lot of not only a black eye, but you also see the petechia within the eye. So you see the reddening there. The only thing to do for that is wait and let the body clean up the fragments and try to rebuild the bone. The ossicles are very small bones found within the ear. And if I haven't pointed it out before, there's a rule. As the structure gets smaller, the word gets bigger. So we see os, it means bone, and ossicle means little bitty bone. These are actually not part of the structure of the skull. They're housed within the petrous pyramid or petrous portion of the temporal bone. And they're freely moving bones inside there. They are made of the 3 bones, the malleus, which means hammer, the incus, which means anvil. So the hammer pushes on the anvil. And then the final one is called the stapes, which we see here. Looks like the stirrup on a saddle, and that's what he's named for. Now, the malleus attaches to the tympanic membrane, which is the eardrum, here, by a fibrous joint. There is a small fibrous kind of ligamentous connection of that bone to the eardrum. So we see here, go away. This is the attachment there. Now, the stapes, by comparison, is attached to the oval window of the bony labyrinth, and we see that area here. So if I enlarge this for just a minute, we see that the stapes is attached right there, and it is fibrous to help keep that bone in place, but we want it to move a little bit. So technically the malleus and the stapes have joints that hold them, let me change that back, hold them in place by fibrous joints, and we want a little bit of movement there, so these are both considered a more amphiarthrotic joint. Now, the joints in between the ossicles So from the incus to the malleus and the incus to the stapes, these are synovial. The joint between the incus and the malleus is called the incudo-mallear, and it is the smallest saddle joint in the body. And the joint between the incus and the stapes is called the incudostapedial, and it's the smallest ball and socket joint in the body. So we see the incudo-mallear and we see the incudostapedial here. Actually, the incudostapedial is the smallest synovial joint in the body as well. And we see it here in this actual picture. Along with the paranasal sinuses that help lighten the face and warm the air, we also have what's called a parotid sinus. Now, parotid easily breaks down into next to ear, I am. So we're literally calling this the sinus which is next to the ear. It is pneumatized, so it is full of these little tiny air cells. These are called the mastoid air cells because the parotid sinus is within the mastoid process. These air cells connect to the inner and middle ear, which is going to allow airflow to go from the middle ear back in to the sinus. Cranial nerve 7 runs through this area, and you will see this in head and neck, which can cause some issues there. And interestingly, inflammation here doesn't affect hearing, which is in the middle ear, at least for the ossicles to move, but it affects balance because it increases the pressure around these areas called the semicircular canals, and we see the remains of one here. And these monitor the movement of the head. So if one of these is getting increased pressure or has an inflammation or infection, you'll see the patient tilt their head to the side to try to place the working ear in the midline and therefore keep their balance. So if you see a patient doing that and you ask them to straighten their head and walk, they tend to walk in a circle. If you allow them to tilt their head back to that lateral position, then they will typically walk more straight.